Hi, I'm so glad to be here with you tonight. I'm here with the Medical Advocacy Mural Project, which is my project. I'm the lone gun who operates that. And my byline that I created when I came up with this concept while my husband was dying of kidney cancer was, let's change the face of healthcare. Because I felt like a lot of times people were throwing off things like face sheet and this and the medical record, and they forgot the reason why we do this is to help a patient. And that all of this has meaning. And my original business card's right there. It has no picture on it because I made it on my home word processor. And then I thought, oh, I'm all about art and vision. I've got to make my business card be only pictures and almost no text. And that's what I did. Do you know this face? Do you know this name? He is not the patient in room 6218. He is not the unfortunate young male, 39 years of age, as is said in his medical record. He is Frederick Allen Holliday II, PhD. He is a devoted husband and a loving father, and he was a professor of film studies, and he was a great friend. That's who he is. And he spent 79 days hospitalized for kidney cancer, and during that time frame, I fought for access to his medical record. I met him, oh golly, over 17 years before, and my husband met me twice. He met me once from behind while my hair was really long and I was painting on a flat, and he fell in love with me immediately. And the next day I cut my hair. And so he met me again. Oh my God, thank you. And he fell in love with me again, but this time we were actually talking face to face. We had a common interest. We were really into Stephen King. I mean, really into Stephen King. We talked Dark Tower, we talked Gunslinger, we talked all about The Stand, and Pet Sematary was both of our scariest books. So we really caught on. Do you know this face? Do you know this name? She's not the wife in the room unhappy with progress. She is not little Miss A-type personality. You know, when I asked for that medical record for days and days and days and nobody would give me the access to the information, one hospitalist let me see 3 minutes at a computer screen, and he told me he wasn't even supposed to show me that. When he did this, and I fought for weeks trying to get the data, when the doctor who was my husband's oncologist came back in town from a medical conference, he went to my husband immediately and said, if your wife, little Miss A-type personality, has information she would like, she needs to come to my office hours. And I did. And he never shut the door, and he never stopped taking phone calls, and he never stopped dealing with the nerves and parking situations in the parking lot, while I'm getting the one opportunity to try to find out where all the bone meds are within my husband's body. This was really hard. And on May 30th, when my husband was in hospice care, I decided I was going to do something about it. This is my husband's medical record, and Ted took this picture. And I met him on May 27th, 2009, and I told him what I had planned to do that weekend was paint a really big mural in a local delicatessen. That was my husband's medical record on a chart, on a wall, about 5 by 6. And it would combine the concepts of the nutrition facts label and my husband, the picture of him, and all of his medical record in an easy to understand format that anybody could understand. So no tech, no nurse, no anyone would accidentally break my husband's leg because they didn't understand the level of bone metastases he had, because that's what had happened to him. So this is what I decided I would do. And that piece of document, that data that you see there, I fought for weeks to get it. And there's been many comments about me online because I'm a big I tweet, I blog, I do everything. A lot of people say, she must not really try very hard. I want to let you know the B story. I'm a big A-B story kind of person, really in the narrative. Husband wrote his dissertation on Buffy the Vampire Slayer. We've talked about this stuff a lot. And there's a good story always, right? Well, the big story was when my husband got sick and I found out what was going on, I ran research on the internet about the stage of his condition myself. I started figuring out there's a really good chance my husband was going to die in a really short period of time. And guess what was going to come out in October? Stephen King's Under the Dome. So within days of my husband going to the hospital, I immediately got online and tried every avenue I could to get a galley copy of a book that was not available to anyone. Went to the publisher, talked to everyone, and finally got to Stephen King, and within a week, I had the only copy of Under the Dome that I could hand to my husband. That's what you can do if you try really hard, and I want to tell you, that was the same person who could get the medical record. So I painted it. And within days, all those wonderful people that I just met 3 days before started writing blogs about it. Christine Kraft, Teddy Tan, Cindy Drew. They all wrote these amazing articles about this lady, this crazy lady in Washington, D.C. who's painting about healthcare and changing the world. And then June 17th, he died. And this is what that looks like. And I thought of the gunslinger and all the things that it said. And you know, it says in the gunslinger, you've forgotten the face of your father. He says again and again, I do not aim with my hand. He who aims with his hand has forgotten the face of his father. I do not shoot with my hand. He who shoots with his hand has forgotten the face of his father. I shoot with my mind. I do not kill with my gun. He who kills with his gun has forgotten the face of his father. I kill with my heart. So I would take the pain and the anguish and everything that happened, and I would paint. I would talk, and I would tweet, and I would blog, and I would Facebook, and I would tell everybody in the whole wide world what a wonderful man this was, and how wrong it is to deny anyone access to the medical record. And it would be picked up by the entire world. So I took Death on a Raw, and I took Guernica, and I combined them into this amazing work. And then on that piece, there is one quote: shouldn't art stick to what it does best, the delivery of pleasure, and forget about being a paintbrush warrior? Or is it when the bombs are dropping that we find out what art is really for? And there it is. It's right there on Connecticut Avenue this day, and it's every day advocating for you. And just like the internet, it advocates on a 24-hour news cycle, and you can't have walls shut up. Do you know these faces? Do you know these names? These are all individuals that I met personally during my fight for healthcare reform and advocacy and access to the medical record, or have had friends meet. Do you know these faces? Do you know these names? These are people who've written horror stories that are far worse than anything Stephen King ever wrote. Because they tell you their life story and that horrible time when that horrible thing happened. And just like in Stephen King, you can see it happen, you can see the moment when that person, if they could have only had the medical record, could have told the nurse, please don't give them that drug, because if you do, you're going to die. So I contacted all these people, and I got permission to paint all of them in a really large painting called Give Us Our Damn Data. And one of those wonderful authors who are here today, David Bronkhart. And they're all lined up as Roman citizens with their shields and pens and swords, and they're trying to tell you that we are going to take up these arms to help you. We may be citizens, but we will fight the good fight, and we will save your lives. And so after a year of this, I had the wonderful opportunity to speak at Meaningful Use, and as Ted says, he called me the patient-in-chief, because I had the opportunity to say, this is how patients feel, and this is why meaningful use is so important. We must have access. The story of the person is the most important thing. And I painted a picture of exactly what it looks like and what it feels like when they're not paying attention. And so then I've taken all this data and put it together and created all kinds of pieces of art to try to explain data is important. The picture of the person is important. And then the wonderful people at Clinovation said, hey, let's take your work and show it in a space and invite every single person you know, because the artist, the sales clerk, the shop girl, take all the consequential strangers, use their cognitive surplus, and create an empowered patient. And that's what I want you to go away from here thinking today about how we can all together change the world. Thank you.